Okay, good afternoon. We're going to get started here. First, I'd like to start by thanking my colleagues, Acting Secretary Teresa Miller and Secretary Teresa Osborne, for joining me this afternoon to emphasize the resources and give some advice around individuals and families affected by substance use disorder, and especially around the holiday season. The holidays can be a joyful and celebratory time of year, but as we all know, the season's pace can be very stressful. And for people affected by addiction, individuals with substance use disorder, people in recovery, and their families, the season can bring about some unique challenges. Strained relationships and triggering environments can put people in situations with the potential for a relapse, and spending more time with family may bring a loved one's unknown struggles to light. Whether you are in recovery, seeking treatment for the first time, or need information about how you can help or support a loved one's journey, there are resources available throughout the holiday season. If you're an individual in recovery, it's important to be aware of problematic situations that you may encounter over the holiday season. Spending time with family members who you have strained or no relationships with, attending holiday parties where drinking or other substance use is occurring, or even something as seemingly small as changes to your daily schedule or routine can introduce added stress that may challenge your recovery. By thinking about these situations ahead of time and recognizing what could put you in a difficult position, you can be prepared to overcome these stressful situations. Remember your support system. Let them know that you may need them, and don't hesitate to use them. It's also important to remember that your first obligation is to yourself and your health. If you feel like you're in an environment that is hazardous to your health and your sobriety, it's okay to leave. If you're alone and cannot access your support system, Pennsylvania's Get Help Now hotline is available. This toll-free resource is available 24 hours a day, 7 days a week at 1-800-662-HELP. For people seeking treatment, if you think you have a substance use disorder and you want to enter treatment, you do not need to wait until the holidays are over. Sometimes family members or friends may try asking you to wait in order to keep everyone together for the holidays. But you must remember that no holiday is more important than your health. Your health and safety must always be your first priority, and it's okay to leave and seek medical attention. Again, the Pennsylvania Get Help Now hotline is available 24 hours a day, 7 days a week throughout the entire holiday season. It's a free resource, and we encourage you to utilize it. If you're not comfortable making that phone call, there's even a free chat service that's available, and you can access that resource on our website at www.ddap.pa.gov. And for families with loved ones in recovery can really use this time to provide extra emotional support for their loved one's journey. By creating a welcoming, safe, and compassionate environment, families can use this time to strengthen their relationships with loved ones, especially if they have been previously strained. Families should also do their best to be patient with loved ones. Respect what they may or may not want to discuss, and avoid rehashing old problems. Creating a calm and welcoming environment can help mitigate stress that could challenge a loved one's recovery. Families can also make their homes safe for all visitors by disposing of old and unwanted prescription drugs at any one of the nearly 700 prescription drug take-back locations across the state. A map of these locations is available on our website. Depending on where your loved one is in the recovery process, it may also be wise to limit your drinking or substance use. Doing so will help your loved one to not feel isolated. Family must also be understanding if a loved one needs to remove themselves from a situation. If your loved one needs to leave a party or holiday gathering, do not make the situation about you. Even if you're hurt, and you don't want to see them leave. Be sympathetic to the many unique challenges that recovery presents, especially during this time of year. Leaving may be necessary in order to prevent a relapse. Families can also be prepared for visits with loved ones suffering from addiction by equipping themselves with naloxone, the life-saving overdose reversal drug available at any pharmacy through the standing order issued by Acting Secretary and Physician General Dr. Rachel Levine. If you suspect that a family member or friend has a substance use disorder and needs treatment, the hotline can help you too by identifying treatment options or other resources in your community to help you discuss that concern with your loved one. Again, that hotline is free, it's available 24/7, and the number is 1-800-662-HELP. And with that, I'm going to turn the podium over to Acting Secretary Teresa Miller from the Department of Human Services.
Thank you, Secretary Smith. And thank you to everyone who's joining us today to discuss these critical services. As Secretary Smith said, when many of us think about the holidays, we think about joyous occasions with family, gathering together, celebrating, probably eating one too many desserts. But many of us can experience feelings of anxiety or depression during the holiday season. People who live with a mental health condition should take extra care to tend to their overall health and wellness during this time. Extra stress, sentimental memories, or unrealistic expectations can lead to the holiday blues. Some can be at risk of feelings of loneliness, sadness, fatigue, tension, and a sense of loss. A lot of seasonal factors can trigger the holiday blues, such as less sunlight, changes in your diet or your routine, alcohol at parties, or the inability to be with friends or family. These are all factors that can seriously affect our mood. The National Alliance on Mental Illness, or NAMI, states that 1 in 5 adults suffer from a mental illness in America. These individuals are our loved ones. They're our friends, our neighbors, our coworkers. If you or a loved one are suffering from mental illness, there are services available to help. Mental health services in Pennsylvania are administered through county mental health and developmental services program offices. Each county program office serves as a centralized location to determine an individual's eligibility and appropriate programs for treatment and/or other services that are needed. I encourage anyone who feels that they could benefit from mental health services to visit their local program office. If you or a loved one are in the need of immediate help, please call the National Suicide Prevention Lifeline at 1-800-273-8255. The Lifeline has trained counselors available 24/7 to offer free, confidential support to you or your loved one in crisis. They partner with local crisis centers to save lives and provide suicide prevention resources in your area. In a recent survey by NAMI, 64% of people said they were affected by the holiday blues. As we're in the midst of the holiday season, I'd like to offer a few suggestions for addressing your mental health. Stick to normal routines as much as possible. Get enough sleep. Take time for yourself, but don't isolate yourself. Spend time with supportive, caring people. And get exercise, even if it's a short walk. In the world of human services, you commonly hear people use the phrase, "no wrong door." The Wolf administration is absolutely committed to helping individuals no matter how they enter our system. We're working every day to ensure that individuals we serve have access to high-quality services, and during the holidays, that's no exception. I urge everyone who might be in need of services to get help. Together, we can start to alleviate the stigma associated with mental illness. And now, it's my pleasure to introduce my friend and colleague, Teresa Osborne, the Secretary of the Department of Aging.
Good afternoon. As Secretary of Aging, it is indeed my honor to gather with my cabinet colleagues from the Department of Drug and Alcohol Programs and the Department of Human Services, as together we underscore the importance of how many Pennsylvanians, including our older Pennsylvanians, who are impacted by substance use disorder are affected during this holiday season. As was just mentioned, indeed, the holidays are traditionally a time for celebrations, for parties and get-togethers, but for some, the holiday season can also be a source of those blues that Secretary Miller just alluded to, especially for older people who may think about at this time of year how quickly time passes, or how much they miss their loved ones who have passed on, miss them even more so during this time of year. The holidays can also be a source of stress, as chronic health conditions, concerns about money, and strained relationships with family members can also make these coming days in particular a difficult time for our seniors. It's also important to remember that anyone at any age can have a drinking or a drug problem. I encourage all of you to close your eyes for just a moment and imagine someone who is addicted to alcohol, someone who is addicted to their prescription drug pain medication, or someone who is strung out on heroin. What do you see? Who do you see? Do you see a gray-haired grandmother keeping an eye on her grandchildren? Do you see a wrinkled-faced, well-dressed gentleman who's preparing for his retirement? Probably not. Probably not, but we should, because this is also the face of elder substance use abuse across states and across this country and right here in Pennsylvania. Now I encourage you to picture in your mind good old Uncle Joe. Uncle Joe, who just turned 65, he's gearing up for his retirement. He's always well-dressed in a suit and tie, and Uncle Joe has always liked his liquor. So his family has not noticed that his drinking is getting worse as he gets older and nears that retirement day. Now picture that gray-haired grandmother, Grandma Mary, who's been a teetotaler all of her life until she started having a drink every night to help her sleep after her husband died. And now at age 85, she needs a couple of drinks just to get through the day. Now imagine each of these older Pennsylvanians having balance problems, having memory problems, having mood swings. What are your first thoughts? My bet is that you're thinking, it's to be expected. It's old age. And worst of all, I hope it's not Alzheimer's. Would you ever think that any of these situations, any of these signs and symptoms could be attributed to substance abuse? Most people think alcohol and drug problems are issues that mainly affect adolescents or younger adults. But as we gather here today in this incredible space, substance abuse, particularly of alcohol and prescription drugs among adults aged 60 years and older, is one of the fastest growing health problems facing the country. And yet, even as the number of older adults suffering from these disorders climbs, the situation remains underestimated, underidentified, underdiagnosed, and undertreated for our seniors. Alcohol and drug problems in the elderly are often missed by family, friends, and healthcare professionals for lots of reasons. Symptoms of substance abuse, such as increasing fatigue, diminished cognitive capacities, and balance problems, can be mistaken for dementia or depression. Older adults are more likely to hide their use of alcohol and drugs and are less likely to seek professional help than other age groups. Many older adults are also isolated from family and friends who are no longer close by and no longer involved in their day-to-day life. Multiple medications for health conditions also mask the signs of addiction, and healthcare professionals do not routinely ask about and screen for substance use problems in older adults. So when we do think of older adults with substance abuse problems, it's important that we recognize that there are two groups. The first group are the long-term substance users who have reached the age of 65. We commonly refer to them as the baby boomers. And those baby boomers are taking the use of alcohol, cocaine, heroin, and other illicit drugs right into their golden years. The second group are the late onset individuals. They begin abusing substances later in life. Seniors in this group may turn to alcohol, drugs to cope with stresses, those stresses that are often associated with older age, such as health concerns, reduced income, loss of a spouse or other loved ones, or family stressors, such as their own children caught up in the ravages of Pennsylvania's opioid crisis. And such situations often then create changing family dynamics, such as seniors stepping in to raise their grandchildren due to the opioid crisis. And as several seniors recently met with me and shared with me that they are facing this particular situation, the holiday season is so incredibly stressful for them and their entire family that they cannot wait until it's over. Other stressors include sleeping problems or family conflicts. Even a positive life milestone, such as the one I mentioned, a retirement, can carry risks for substance abuse, and because it offers individuals more leisure time to drink, along with fewer consequences for their behavior. But the bottom line is, and the fact is, that both groups represent seniors. And while we know that alcohol and drug abuse is harmful at any age, it is more harmful in the elderly, as the impact of alcohol and drug-related injuries is much more severe. The risk of harmful medication interactions is much greater, and the general effects of alcohol and drugs is much more debilitating. Recovery is indeed a lifelong journey, and while the road to maintaining sobriety may not always be an easy one, as Secretary Miller and Secretary Smith pointed out, help is available. Drug addiction among seniors is treated in much of the same way as it is for younger populations. In many of the various outpatient and inpatient drug rehab centers in the Commonwealth of Pennsylvania have programs available to assist with addiction and dependency among older adults. For certain, the holiday season can be a magical time, is a time filled with family and friends, good food, beautiful gifts, fellowship, and laughter. But this time can also be filled for many with sadness and stress due to all those myriad of factors that each of us just commented on. And the Get Help Now helpline, 1-800-662-HELP, is available to connect all Pennsylvanians, individuals, and family members, including our seniors, to local resources. Thank you very much.
So I think the common message you heard today is there's help. No matter your age, no matter the behavioral health issue, there is help, and we urge you to seek that. At this time, we'd take any questions. Okay, hearing none. Thank you. Have a good afternoon.